Before here, that is important. Another that is, the chordocentesis, amniocentesis. Sometimes there is a special investigation we do for chromosomal anomalies of the baby, like Turner syndrome, Edward syndrome. There is a role of amniocentesis. What is amniocentesis? The collection of the fluid, of the amniotic fluid, and then it is chromosomal study. Is it possible or not? Possible. Per abdominal possible, per vaginal collection is possible. So you should go through this. There is a triple test. The triple test, Down syndrome. Down syndrome triple test is hormone, estriol, and other two hormones, and that is beta HCG, and another hormone is what? And there is another hormone also, and the triple test, and then chromosomal analysis. So these are the some special tests also. If you suspect there is chromosomal anomalies of the fetus, and if there is high risk pregnancy, we should do at 28 weeks glucose tolerance test. Not always glucose tolerance. The glucose tolerance test. What is this? For screening of the GDM mother, gestational diabetes. For gestational diabetes, we should investigate the glucose tolerance test. Glucose, what I said, glucose. Why we should do? If we suspect gestational diabetes mellitus. Is any mother risk for the gestational diabetes? Which mother are risk for gestational diabetes? Oh, very good. Then family history and past history, and there is past history of macrosomic baby, stillbirth. Like this, if then it is, we should do the screening test by the glucose, oral glucose tolerance. Okay, and these are important in the second trimester. There is a role. And antibody titer, if mother is Rh negative and first, that is first baby, then we should do the anti-D titer. Okay, anti-D titer. Next, and other management depends accordingly. The iron, multivitamin, and others. What are the drugs? Usually we give calcium. If need vitamin D, folic acid is important in the first trimester. And if she is anemic, then anemia correction should be quickly. If she is hypothyroid, should be replaced by the thyroxine. If there is vitamin D deficiency, usually nowadays vitamin D deficiency is so common. So replacement of the vitamin D. And other management, if she had suffering from UTI, UTI is so common during pregnancy, constipation is so common. So we should manage accordingly. Okay. Now third trimester. What is the third trimester? It is very, very important for what? To rule out the high risk pregnancy and to find out the complication earlier. So she had been suffering from what? Recurrent urinary tract infection, pervaginal bleeding, anemia, urinary tract infection I told already. So we should, also diabetes mellitus. So we should rule out this problem. So carefully we should check up the general examination and the per abdominal examination. What are the per abdominal examination? Already you do in the ward, the classes. Yeah, fundal height, the growing uterus, the fundal height, you know the measurement at the level of the umbilicus, 20 weeks, just above 22, and then 24, 24 weeks from the umbilicus, and at the level of the divestrum it is 36 weeks. So you should know the measurement of the fundal height and the fetal lie, longitudinal, oblique, or transverse lie, and then presentation of the fetus. And then very, very important is fetal heart sound and also fetal movement we need to feel. And here one of the important is the fetal growth chart. You know the fetal growth chart. Fetal growth is, how can we find out the fetal growth? By ultrasonographic guidance we can serial ultrasonogram. By serial ultrasonogram we check the fetal growth chart. Why it is important? Why it is important? Fetal growth Is fetus is normally growing or not? Fetus is affected by the mother condition or not? Or the environment of the fetus, that is placenta, placental function, nutrition, maternal disease, that is, or fetal itself having suffering from the disease, right? What are the diseases of the fetus? When fetus is a patient, when fetus also may be a patient. Why? That she had suffering from congenital illness, she had suffering from lung disease, kidney disease, cardiac disease, infection, fetal infection, you know the torch infection, where fetus is suffering from also from the infection. So fetus also we should know above all the condition. So fetal monitoring, there is a term fetal monitoring during antenatal care. Fetal monitoring, sometimes we told the mother picture, you know the picture, how many times fetus movement, mother can understand. Normally at least 10 times in 24 hours. So picture and fetal heart rate monitoring by normal stethoscope. Another is Doppler study. Another is CTG, you know the CTG, cardiotachograph. There is a machine. There we place electronic monitoring of the fetal heart sound. Along with the contraction of the fetus, there is a record, there is a graphical presentation like the ECG. You saw the ECG paper. Like this, there is a CTG, cardiotachograph. Fetal heart sound monitoring, and along with contraction, what is happened. When fetus move, what is happened in the fetal heart rate? What would be? If fetal movement more, fetal contraction more, then what? Acceleration. That is called, very good, that is called acceleration. How many times more from the baseline? At least 15 times. A normal baby, normal fetus should increase the cardiac activity at least 15 times when there is contraction and then when there is a movement. Can you follow the class or not? Yes? Boring? Yeah. What you do? You should tolerate. The doctor should be patient. Doctor should be tolerate so many adverse situations. You know that sometimes there is when I am in the resident surgeon in Dhaka Medical College. I was resident surgeon for 5 years. Sometimes it's so electricity problem. That is the year 2001 to 2006. In the year 2001 to 2006. There is always shutdown of the electricity, and I am a surgeon. OT is not over there at that time. OT not so large. Sweating, radiation. I can bring the charger from my home, and you cannot believe. Doctor you should manage the emergency cases. So from now you should learn how to tolerate the adverse situation. Is it not? Doctor should be patient and confident and okay, now I am going to finish. Okay, then so third trimester is the bio. You know there's another important. Listen, another important term is biophysical profile. Biophysical. You can get time later, no problem. No need to do now. Biophysical profile. Bio means life activities. Life means activities. So biophysical means movement. So biophysical profile, we sometimes mother complex less fetal movement. It is so common complaint. Less fetal movement, so common problem. So we should give assurance to the mother. Let us see. We should follow the picture. Give a paper and how many times fetal move she make a mark. And then we request to the sonologist, please see the biophysical profile. So that is 5 important points for the biophysical profile. Every time it is asked, what are the points for the biophysical profile? You imagine my fetus in the uterine cavity. Fetus, we want to see the movement. So what are the movement in the body? Cardiac movement. Okay. Number 1 is cardiac activity. Number 2 is breathing movement, breathing, lungs movement. Okay. Number 3 is gross body movement from one point to another. Another is limb movement. Okay. Another, number 5 is amniotic fluid index. That is one of the marker of the biophysical profile. So what I say, you should remember all this. Cardiac, breathing, limb movement, gross body movement, and amniotic fluid index. Another points we add sometimes, that is CTG. CTG, the cardiotocograph, cardiac monitoring of the cardiac activity by a machine that is known as CTG machine. So these are the important. And management depends upon the normal management and management of the complication. If there is complication like the antepartum hemorrhage, chronic UTI, cardiac problems, bronchial asthma, hypothyroid like this, diabetes mellitus, we should manage accordingly. Okay. Otherwise, we should every time, third trimester. Usually every week we saw the patient, and otherwise we should always alert the patient. You should remember the fetal movement. That is so important. Fetal movement. If the fetal movement less, she should come earlier. Nowadays there is one problem in that is so problem for us in the management by the sonologist in the peripheral unskilled area. That is, they tell in the last trimester ultrasonography can ensure you the dating. No, only first trimester can ensure the dating. So they go to the sonologist and they do ultrasonogram and they write wrongly the 36. Even the baby's 40 weeks, they wrote 36 weeks. Yes, and the last trimester it is not possible actual dating of the pregnancy. So they wrongly wrote the dating of the pregnancy and the patient believed the pregnancy. You know, today in our ward, in our ops ward, at the Medical College Hospital, there is 2 patients in IUD, intrauterine death. Why there is intrauterine death? The sonologist wrote that is 36 weeks, so they wait, and then fetuses die. Okay?
I'm sorry.
Yes, I saw, yeah. Okay, so this is the problem. So management should be according to the protocol. There is a nice guideline, there is RCOG guideline, and so we have also a guideline. So we should follow this guideline. Assalamu alaikum. Okay, thank you.